Welcome to the Health Zone. My name is Dr. Toju, and on today's episode, we will be talking about reproductive health. Let me start out by saying that reproductive health is a very broad area, and it covers subjects like pregnancy, childbirth, infertility, birth control, and many other areas. And I also want to be quick to say that this isn't a subject that only women should be interested in. Any man who has a wife, a mother, a sister, a female cousin, or even a female friend, and I think just about every man does, all men should be interested in this show as well. On today's episode, we're going to be focusing on fibroids, which is a condition that's more common than we think it is. And with me in the studio today to help us understand fibroids better is Dr. Chito Nwana. Dr. Chito Nwana is an American-trained and American board-certified consultant obstetrician and gynecologist. She's also the medical director of Tabitha Medical Center in Abuja. Her area of specialty is minimally invasive gynecological surgeries, such as laparoscopic surgeries and hysteroscopic surgeries. She has done extensive medical research in the areas of cervical cancer screening and healthcare disparities, and she has presented at numerous international conferences. Her passion, though, is to educate Nigerians on health issues. And to this end, she has initiated several community-based programs focusing on creating health awareness. Dr. Chito, welcome to the Health Zone.
Thank you, Dr. Toju. I am happy to be here.
Now, Dr. Chito, as we always do on the Health Zone, before we go into the medical description of fibroids, we usually go to the man on the street to find out what the average man and woman knows about the condition. So we will be going now to the man on the street to find out exactly how much they understand about fibroids.
My name is Wanola.
My name is Hanifa.
This is Ike Michael.
You're welcome to another lovely segment of Man on the Street on Health Zone.
We're going to go out now and find out from people what they know about fibroids. Please come along.
I think I know just a tiny bit about fibroid. Fibroid is something that generates in woman's stomach. That's what I know.
Fibroid. Well, usually the only thing is that some people they like it, some people they don't like it. But I myself I like it to eat it sometimes, but not be always.
The only woman problem.
Now, the man used to have fibroid. No. You can see it in the men, but it's very scarce in the body of the men.
Fibroid for ladies or what?
They say a woman problem.
I think so. Am I okay?
Fibroid, I think it's this growth in the womb that kills baby, right? Like they have to operate it before a lady can conceive and all that, right?
Fibroid is that ailment or a disease that prevents a woman from conception.
It normally block the womb or something like that. So most of the time, something I know is inside their stomach.
The science used to come from my own understanding and my relation with the people that had it is constant stomach pains and irregular, what do they call it? Irregular menstrual cycle.
I've never experienced it, but I've been hearing people having it. That they normally disturb them from having child, something like that.
And that's the Man on the Street segment of Health Zone. Until we come your way again next week, make sure you stay healthy.
It's amazing what the man and woman on the street think about fibroids. Those were some very interesting responses. Dr. Chito, can you tell us what the medical definition of fibroids is?
Uterine fibroids are defined as non-cancerous growths in the womb. And when I say non-cancerous, I mean not cancer. And it could be as tiny as being very microscopic to being very large. It is found commonly in black women. Really, out of every 10 black women, you can find it in 8. And we find it, the common ages you will find it is between the ages of 40 and 50. So that's really the definition in a nutshell.
Okay, do we know what causes fibroids?
There have been so many theories of what causes fibroid. Some people link it to family history, hereditary. Some people say it is due to the hormones that we have naturally as women in our bodies called estrogen and progesterone. And some people link it to just, a kind of more of a genetic alteration of some sort. So the theories are kind of complicated for the layman. So we haven't any specific cause that we can say this is the direct cause for fibroids. So right now, mostly just theories.
Okay. What kind of symptoms does somebody with fibroids have?
Symptoms are really, let me start by saying most women don't have any symptoms. And symptoms really arise based on with the size of the fibroid, where the fibroid is located in the womb, and also how many fibroids you have. And so you can experience things like pelvic pain, which is pain in the lower part of your abdomen. You can have pelvic pressure, which is also that feeling of pressure in the lower part of your abdomen. You can have what we call excessive bleeding during your periods or irregular bleeding. And some women will experience large clots during that time. You could have people that complain of frequent urination because the fibroid is pressing in the bladder, or complaining of constipation, bloating, or hemorrhoids, which people call pile in the lame term, because the fibroid is pressing on the intestines. And as an obstetrician, you find that is linked a lot to infertility or complications arising in pregnancy like miscarriages.
Dr. Chito, you had mentioned that it's common in women between the ages of 40 and 50. Does that mean that's the only age group of women who should be concerned about fibroids?
Well, between the ages of 40 and 50 is a common time where we see that women have the fibroids that will concern us. But right now, I'm actually noticing that women younger than that, in their 20s and 30s, are actually presenting with fibroids. And I'm not sure if that's more linked with a family history, but we're seeing more women, a lot of women coming pregnant and not pregnant with fibroids within that age range.
That's very interesting. Now, do you have any interesting cases you can share with us? You don't have to mention names, but to just give us an example of how fibroids affect people in real life.
Actually, I have a very encouraging, or I say a very nice case to share, which will encourage a lot of women with fibroids. I had this patient who came to our office at about 9 weeks pregnant, and we noticed that she had a lot of fibroids that were really large. And we're very concerned about how her pregnancy will go in terms of miscarriage or if later on preterm labor. And actually she did very well. She carried her pregnancy to term. Of course, we monitored her very closely, and we delivered the baby by cesarean section, Helen Harty. So that's one of my really nice positive cases that I always like to share with patients.
I'm glad you shared one with positive outcome for us. We don't want to frighten our patients. Now let's go to an interview that we did with another young woman who had the issue of fibroids earlier this year. Let's hear what she had to share about her experience with fibroids.
The kind of symptoms I had were fainting spell, blackout, and some months before I went to the doctor, I noticed that I had a bulging stomach. Being somebody slim, I could easily notice that. After the evaluation and test, the doctor told me that I had several fibroids, one of which was leaning on my kidney, and because of that, I had elevated blood pressure. The kind of treatment I was told was the best option as at that moment was immediate surgery to remove the fibroid, which I did, and immediately the elevated blood pressure disappeared. On how I'm doing now, the recovery is very slow, going to almost 5 months now.
Welcome back to the Health Zone. Today we're talking with Dr. Chito Nwana. Dr. Chito, let's address some of the myths that we heard from our man on the street interview segment. Is it true that fibroids can prevent a woman from getting pregnant?
No, it's not true. A lot of women who have fibroids have become pregnant. Where we have issues with fibroids depends on where it's located, and sometimes when it's located near the inside of the womb, then it can pose a problem in terms of conceiving. But at that time, most times at that time, the doctor will then recommend to remove the fibroid from that area. So I will say most women that have fibroids do get pregnant. It's just a very small percentage of people that have problems.
So maybe I'm not quite understanding you. Are you saying that depending on the location of the fibroid, it can cause miscarriages?
All right, the way I describe it to my patients, I ask them to imagine an avocado pear. And now an avocado pear in the inside has the seed where it sits. On top of the seed, it has a little lining on top of that seed. Then you have the meaty part of the pear, and then you have the outer skin of the pear. So imagine that being the womb. Now, if you have the fibroids where the seed would have sat in the pear, right, it's going to obstruct, of course, in the womb where the baby stays, where the placenta stays. So that could cause the miscarriage, because sometimes the placenta will plant on that fibroid, and that's not a good place for it, and so the body will reject it. Now, if you have the fibroid in the muscle part of the womb, which is like the muscle part of the avocado pear, sometimes it can grow and press into the middle of the womb, and that could cause miscarriages and, of course, the abnormal bleeding that you see, all right? But if you have your fibroids in the muscle part but not pressing into the entrance, or you have it on top of the skin of the avocado pear, you should have absolutely no symptoms really, unless it grows really large, and then you have the problems that will come if it's a really large fibroid. So that's why I say it really depends on the location of the fibroid before you see those problems with miscarriages. So a lot of women have fibroids that are not there, so they don't have that risk.
Okay, so let me get this clear. You're saying that fibroids do not necessarily cause miscarriages.
Definitely, that's what I'm saying. So that's one of the myths that I try to squash. Fibroids do not necessarily cause miscarriages, but it could predispose you or increase your risk of having one.
Okay, that's very interesting. Thank you for clearing that up, Dr. Chito. My other question for you is that on the Man on the Street segment, people had a lot of ideas about what fibroids is. And based on what you've told us so far, it seems like fibroids can really cause serious complications. Can you just clarify that for us?
I'll emphasize that when you talk about complications, as I said before, it really depends on the size and depends on where the fibroids are. But most times, it's serious when you don't, like if you don't recognize it, for example. For example, some people have very large fibroids pressing on their bladder, for example, and they don't know it. So in that case, it can lead to certain complications that are serious. So that's why I always emphasize on people going to their doctors yearly to check themselves out, because you can always pick up on a fibroid that's growing that large. But other than that, I won't call it very, very serious unless it has any of these features.
Another myth that I have heard is that if you have fibroids, it means you must have a hysterectomy. Is that true?
No, that's not true. That's another myth. And the fact is, we've really, most times hysterectomies are now reserved for women that have finished having children and have fibroids that are causing them problems. Because a hysterectomy is actually the permanent solution to treating fibroids. But in cases where women are still planning to have kids and or young women, then you will not choose that as an option unless you want to save their lives, unless it's an emergency. There are many other ways of managing fibroids now. We've come a long way from the 70s where hysterectomy, and let me define hysterectomy, I'm sorry. Hysterectomy is removing the womb. That's what that means in lame terms. So we've come a long way from that. So we have other ways of managing fibroids.
Well, that's good to know. So it seemed like in the past, the cure was worse than the actual condition itself.
Yes, it was, especially in our environment or our culture where having children is so important. So that was why sometimes when you do a hysterectomy on a woman that still plans to have children, it can cause a lot of social and emotional issues. And so I'm happy that we've come and we have other methods of managing fibroids.
Can you tell us some of the treatment options for fibroids now?
Well, I would like to divide the management of treating fibroids into 3 categories. The first one we call expectant management, meaning we just watch, we just observe, we don't do anything. And that's actually most of the fibroids that we see. They come, maybe they went to doctor for a pelvic pain or pressure, and then find out incidentally that they also have a fibroid. In those cases, just yearly, we just monitor those fibroids and make sure they're not growing very large. Then you have the medical treatments. We have drugs now that can shrink some of these fibroids, but these drugs do have their own side effects. So most of the common drugs could put you into kind of a temporary menopause state and cause you to have hot flashes and other things like that. But I want to note that most of the medical treatments are just very temporary, so they don't last long. If you stop using the drug, the fibroids will grow back again and may even be larger than it was before. So we use them more for temporary measures. And then you have surgical management, which is, even though it's temporary, it lasts longer and more effective than the medical management. And the different surgeries we do right now, of course, is laparoscopic surgeries, which is a really minimally invasive surgery. So by putting little incisions on the abdomen, we can put our camera in there and remove the fibroids, and the woman goes home that day. And of course, we have certain patients that are okay for that kind of surgery. And then we have the major surgery in which we have an incision on the patient's belly, a larger cut, and we take out the fibroids that way, and that's called a myomectomy, removal of the fibroids. And of course, the permanent solution, which is a hysterectomy, as I described earlier, that's reserved for certain patients.
Terrific. It sounds like there's several options that are very reassuring without going drastically to surgery right off the bat with fibroids. Now, Dr. Chito, can you tell us what is your recommendation as far as women going to obstetricians and gynecologists when it comes to fibroid treatment?
I think based on what I've seen in Nigeria in terms of since I've practiced here, it's very important for women to understand this. Fibroids will not kill you, basically. And I think rushing to surgery in most patients is not necessary. So they need to really consult with a qualified gynecologist to find out what do you recommend for me in my situation. If the fibroid does not bother you, it doesn't bother you, it doesn't bother you. You don't need to do anything with the fibroid. Your doctor will just watch you and make sure it doesn't grow large or it doesn't grow, push into any dangerous area. But if it's something that bothers you, then doctor will also recommend whether you're good for medical management or you're good for surgical management. But I would like to say kill the myth that you need surgery every time you have fibroids. You need to be evaluated properly and then let the doctor tell you what you need.
Dr. Chito, thank you for clearing that up, because I know that is a myth that's out there, that you always must have surgery to treat fibroids. So thank you for clearing that up for us. Now, just a few take-home points. That is that fibroids occur very commonly in 8 out of every 10 women can have fibroids. It's very common between the ages of 40 and 50, but now more and more she's seeing younger women with fibroids. Fibroids do not necessarily prevent you from getting pregnant. Fibroids can cause problems with infertility, but only 20% or so of fibroids actually can cause complications with infertility or with miscarriages. And also, as Dr. Chito very nicely put, Make sure if you've been diagnosed with fibroids that you have a competent gynecologist or obstetrician managing your condition, and follow what advice is given to you. And lastly, that surgery is not always the answer to the treatment for fibroids. Dr. Chito, thank you so very much for joining us in the studio today.
Thank you, Dr. Toju. I did enjoy myself.
Well, viewers, please tell your friends, your neighbors, your family to join us to learn more about fibroids, a condition that has serious implications for women. To find out more information, you can go to our website, which is showing on the bottom of your screen now. Join us next time as we discuss diarrheal diseases and the tremendous impact that it has on the health of the nation. This is Dr. Toju Chikiobi signing off for the Health Zone. Remember, stay healthy.